Platelet-rich plasma is a fraction of your own blood that contains platelets, these segments in the blood that are responsible for clotting and helping the tissue heal back up. And in certain granules called alpha granules of the platelets are a bunch of these growth factors that help new collagen or tendon tissue grow, new blood supply grow. And what we have found is if you can concentrate these platelets sufficiently, which is done with a centrifuge type device, and actually use guidance like ultrasound to inject into a tendon on a tendon that hasn't healed over a period of time, it markedly accelerates healing response. The body has a tendency to obviously try to heal itself, so we can talk about different things that we know it works pretty well in. One is a very common problem called tennis elbow, or a problem with the common extensor tendon at the elbow. And you get a tendonitis, overuse, injury, flares up, and most of those with traditional therapy will get better, but there's a subgroup that just doesn't. And what happens is the body's inflammatory response just basically stops, and it becomes more of a scar tissue that's there, and the body just can't heal it up. So some people are left with those chronic residuals. So the concept of platelet-rich plasma is to take that person's blood, prepare it in a centrifuge to spin it down and concentrate it, and then inject the plasma into the area of damaged tissue to stimulate, or what I tell patients, jumpstart a healing response to try to get the body to repair itself. And actually, from the standpoint of the applications of platelet-rich plasma, because it's being used for lots of different things, but as it relates for orthopedic injuries, I think it's clear that's where we found our biggest success with using platelet-rich plasma, is for these chronic tendinopathies that just have not responded to conservative treatment. Well, I think there's lots of different applications for PRP. I think we're seeing it now being used quite successfully in high-performance athletes. College Division I schools use it. Certainly professional teams now, this is standard part of their treatment programs for their athletes. Local use that we've seen significant success in, for example, has been pitcher's elbow, an injury to the inside of the elbow, the ulnar collateral ligament, or what's called the Tommy John injury or Tommy John ligament, that we've really seen that on a partial tear that we can identify either on ultrasound, which we do in the office, or an MRI scan, which is another way of looking at this very, very well, that if it's a partial tear, that injury has responded extremely well and predictably to platelet-rich plasma injection. So it's a very non-invasive, it's very safe because it's the patient's own blood. You're not using somebody else's blood for this. And it does take a little while for it to heal, so we have to protect it for a while, but the healing rate of that has been very, very predictable. So that's one example where it's a ligament that we're using it for. We use it for tendinopathies. Again, the most common things we see is there's a soccer player, for example, that's got bad patella tendonitis in the knee, and they've done all the rehabilitation and it just doesn't seem to heal up. From a minimally invasive standpoint, to be able to go in and inject the platelet-rich plasma into the tendon to get the tendon to heal up. So I think that's really where we see it, from partial thickness rotator cuff tears in the shoulder to tennis elbow or golfer's elbow or jumper's knee, Achilles tendonitis. I think that's where the most promise of PRP has been. I think the issue for availability of PRP, because I think we'll see this becoming, right now it's relatively focal and there's some misunderstanding about PRP. I think today there's excellent content available on the internet. So I think if someone has interest in PRP, is this a reasonable option for you? I would check with local sports medicine physicians. We've been using platelet-rich plasma at Charleston Sports Medicine now for 2.5 years. Maybe it's an early adaptation, but I think the science is very solid. We've got good peer-reviewed evidence that this is effective for certain applications. I think that's the key, is what certain applications are. We happen to use a system called the Harvest Smart Prep system. It's a centrifugation system. And that's an issue because the American Academy of Orthopedic Surgery and the sports medicine groups are looking to better define what platelet-rich plasma is, because there are different centrifuges available on the market and not all of the product is the same that comes out. So I think the science is very strong on which ones are the best, and that product I think is one that should be done, and it's best I think done if it can be done under ultrasound guidance, which we do at Charleston Sports Medicine, but where you actually look at the tendon and realize it full time with ultrasound and then inject the tendon under ultrasound control. I think that is the combination, along with the appropriate rehabilitation afterwards, that gives the individuals the best chance of getting a successful result with platelet-rich plasma.